Hi there, welcome back to the channel. My name is Meg, Nurse Meg from nursemegrn.com, and this video goes out to every nurse I've ever precepted, all 50 something of you. I love you so much. Aww. Just as a quick introduction, I've been a nurse for 12 years, and the purpose of this YouTube channel and my blog and all my social media platforms are to help create better nurses and more nurses and nurses that are confident and love what they do because they're so freaking good at it. I share all of my tips and tricks with you because I love you, and I'm pretty short-staffed at work, so I would love more competent nurses to be working. So of all of the preceptees that I've ever precepted, they all have one thing in common. They are petrified to call the doctor, terrified to call the doctor, or even like approach the doctor or be like, excuse me, Dr. So-and-so, I need help, or what do you think about this? They're so scared. So I'm gonna make a video all about how to talk to doctors. This video is for nurses. I want you to remember that doctors are people too. They are mothers and fathers and sons and daughters, and they're stressed out, and sometimes they don't know what they're doing either, and it's okay. They are humans, so treat them like humans. And if they have an ego or God complex, really stick it to them. That'll be another video on how to humble doctors with giant egos. Anyway, a lot of communication with doctors happens over the phone because they are so busy. The amount of work that they put on modern day doctors is not worth the compensation, in my opinion. I cannot believe how many patients they have to see in one day, especially if they are like a consulting doctor that also has to see people in the office, discharge and admit patients in the hospital, round on those patients, and also do procedures. It's insane. Like how, why, and then on call, not worth it in my opinion, but they have chosen their path. So let's talk about how to talk to these doctors over the phone. I'm gonna give you almost like an exact script, and all of these scripts and advice and things that I am giving you, you can find in my new nurse survival guide. I've sort of created like a course and a little capsule of all the things that I teach my preceptees in the 12 weeks of orientation or preceptorship or whatever your hospital calls it. It has printouts, it has videos, it has instructions, it has scripts. It's literally everything you need to be an awesome, successful, brand new nurse on your floor. So if you want a link to that, I'll put it down below in the description. So here we go, talking to doctors. So what do you do before you call a doctor? So let's say you have like some sort of like order that needs clarification, a lab that you need to address, things like that. Have their chart open. So have the patient's chart open that you are calling the doctor about. So you know like their labs, you know the current orders, you know their allergies, you know their current MAR or medication list handy in case they ask you a question. So also have a pen and paper ready to write down what they say. So let's do like a sample one, and I'm going to read right off of the course that I have. So a sample conversation between a doctor and an informed nurse. So the nurse calls the doctor. Hello, Dr. Smith, this is Meg on PCU. You're taking care of Mrs. Smorgasbord with the perforated bowel in 4408. Yeah, sure. Hey, what's going on? I'm calling you because, so you introduce yourself, your department, and introduce the patient, like last name, room number, something like that, or all of it together, and maybe like, oh, she was the GI bleed, or she's the perforated bowel case, almost, you know, giving her or him a little hint as to what patient you're talking about. And then right away, get to why you're calling. I'm calling you. That should be your first or second sentence. I'm calling you because she has a fever of 101.7 and her white count is 52 today. So you're presenting information because you are a detective. As a nurse, we are the detectives, and we gather all the information and we present it in a way so that the doctor can make a decision. So if we just called and was like, her potassium's this, and she was hungry in the middle of the night, and with focus, she has a fever and she has a high white count. There's a probable infection. So let's tell the doctor to order something for the infection, or I think this patient has an infection, without actually saying it. So Hello ma'am, Dr. So-and-so, calling you because the patient Smorgasborg has a fever of 101.7 and her white count is 52. Oh, I'm not familiar with this patient. How long has she been having fevers? What was her white count yesterday and the day before? Is she already on antibiotics? What day post-op is she? So if you have the chart and you have all the information, you can answer those and rattle them off right away, not waste your time and not waste the doctor's time, because she's busy too, or he's busy too. Always answer in clear, short answers. Don't give unnecessary details. And you want to give a clear picture of your concerns and have all the info handy so that you can answer all the questions, because you don't want to waste any time, like I said. And then you want to get orders promptly so you can fix your patient. This is why you never delay calling the doctor. Like if you get some new weird not okay symptom or some weird new not okay lab result, something, don't delay calling the doctor. Put your fear aside and think about the patient. Think of it as like your family member, your favorite aunt, your mother, your father, your sister. You want to get the doctor involved right away. You want to fix your patient. Delay in care is how infections and disorders can become deadly. So always notify the doctor early if you are concerned. And better safe than sorry. If the doctor's like, yeah, I know, it's not a big deal. Okay, bye, thank you. And then chart that you called the doctor and exactly what you notified him or her of, and that she said no further orders. Always document when you call the doctor whether they give you orders or not. If you assess your patient well and have the chart in front of you, there should be no reason that you are intimidated to talk to the doctor, to communicate at all. Because remember, you're both there to help the patient. You both have the same goal. You want to fix the patient, bring them to a healthier state by the end of your shift, and then go home with a clear conscience, right? Right? That's what we all want. So if you have any questions on talking to the doctor or talking to anyone at work, or even just finding your voice as a brand new nurse, put down below in the comments that you are at that stage of life. I do have a little mini course called Finding Your Voice as a new nurse, and it's literally like how to initiate report, how to give the best report, how to talk to doctors, how to talk to other departments, like just literally how to communicate as a brand new nurse in every scenario. And of course I give you printouts and scripts so that you can take it to work and be like, oh, have confidence because you know what to say. If this video helped you, let me know. Click that little like button to let me know that you made it this far, and subscribe to this channel for more really helpful, insightful nursing tips and tricks. So thank you so much. I love you so much, and let me know how I can help you further. And of course, let's be friends on social media. So I'll put links down below to all my social media and things. And I'll see you in the next video. Bye!